So
Yeah.
what sort of things can you detect from looking inside somebody's mouth?
Well, I mean, you can actually get an idea of systemic conditions and diseases in general. One of the, I wouldn't say it's the easiest to spot, but one example I could give you, iron deficiency anemia. So if someone's anemic, you can actually get quite a flat, shiny tongue. So you lose all the little bumps on your tongue. Bleeding gums can just be an indication of gingivitis, but certain types of leukemia actually cause bleeding gums. So you're looking for different. You wouldn't immediately assume that's what's going on, but there are other conditions that you would see that manifest in the mouth. When we do an exam, as you say, the first thing I always do, get the patient to open up. I might check the lymph nodes in the neck even before you open the mouth, but you get the patient to open up, tongue to one side, tongue to the other side, tongue up, tongue out, and you're looking all around to see whether there's any lumps or bumps, white patches, red patches, things that don't quite look normal. More often than not, they're completely benign and there's nothing to worry about. It might be just an area where you've just bitten your lip or you've burned yourself with something. It's just an area of trauma. It's just a mouth ulcer. But sometimes it's not, and simple things can turn sinister. So we're trying to spot things before anything, does become more serious. And an early sort of diagnosis and intervention is always great, because if it is something like mouth cancer, you want to get it early. So you just, strange things like that, we look and think, okay, well, we either want to refer you off to someone else, let a specialist look at that, or maybe we'll get you back in a couple of weeks and see what it's like. So that's, those sorts of things.
So that's right. So the next step is essentially that you would then refer to the GP or the specialist or something if it was something sinister. You don't necessarily deal with it yourself. We would normally refer off up to Nobles, to say the oral surgery department or oral medicine department up there, and let Mr. Devone or Mr. Malacredi have a look. They're much better at sort of doing biopsies and taking samples than we are, because they're doing it all the time, and there's sort of guidelines as to how much you want to sort of remove to get, you want a sound margin of decent tissue as well as suspect tissue. So you're always sort of thinking, right, sometimes I'll keep an eye on that, and then other times I'll send that off and let someone have a look. If it's a patient you've never seen before and they present with something sinister like that, you'd phone up and just say, look, can you have a look at this patient really quickly for me? And they'll normally get them in very, very quick. If it's one of my patients who I've been seeing every 6 months, more often than not, it'll be a mouth ulcer or it's a burn, and I'll just say to them, right, let me see you in a couple of weeks, or if it's gone, just phone up. Don't just cancel the appointment, so that but they know themselves not to ignore it. So I can always sort of just say, is it still there? I can give them a quick ring, and prod them in the right direction.
How common is something like mouth cancer?
It's quite rare, but again, it's the risk factors that come into it. You can have a white patch in the mouth, and certain types of white patches, 1% might turn cancerous. Others can be what they call pre-malignant conditions. So some white patches will never turn cancerous. Other white patches, 90% of the time, they're absolutely fine. It'll just be a white patch that stays there. But there's that small percentage that can actually turn sinister. So if you've got a white patch that's okay, and maybe you've had a biopsy and you've got a clear result, but you might get a report saying, but see your dentist every 6 months just to keep an eye on this, so that if it does start to change, someone can refer you off straight away. And don't forget, you don't have to have teeth. I've got patients who've got full dentures, so they've got no teeth, but you're still getting them to take the dentures out, and you're checking top and bottom, under the tongue, around the mouth, because it's not the teeth that will turn cancerous. It could be a patch on the gum that can turn cancerous. So that's what you're sort of checking for. So just because you haven't got any teeth, don't assume, well, I never need to go to the dentist ever again. There are other things that we want to sort of check and look for.
And are you more at risk from mouth cancers if you are a smoker? And if that is the case, have you noticed any difference with the more and more people turning to vapes and e-cigs? Has that changed anything?
Yes, you're more at risk if you are a smoker. And if you are a sort of, I'd say, a heavy drinker, I'm not sure what the relationship is between, say, pints and spirits. I know sessions I've done at Fazakli in the UK, where they've been on sort of oral cancer clinics. A lot of patients would smoke between sort of 20 and 40 cigarettes a day, and they might drink anywhere up to half a bottle of whiskey a day as well. So quite heavy smokers and heavy drinkers. But then you also get some patients who have never smoked, and you'll see a lesion in the mouth there, and you can get the same type of sort of carcinoma. It doesn't have to be there's a smoker's one and a non-smoker's one, but usually non-smokers who have suspect lesions, if it does turn out to be cancerous, it can be more aggressive, because something's triggered it and they don't know what. Whereas the smokers, it's usually the continued sort of effect of smoking, and all the other chemicals and the heat and things that go with the smoking that's caused it. As far as I know, with vaping at the moment, there aren't any studies in. It's too early to sort of say there's a risk with vaping. They've done sort of lung function tests to see whether the vaping has an effect on the lung function. But as to sort of oral cancer's an effect on, I mean, smoking can affect your gums. It doesn't have to be, if you smoke, it's going to be a cancer type of effect. It can be a gingivitis and then a periodontitis, so it can be a gum disease and a bone disease effect. And again, I don't know whether vaping has any effect on the gums yet. Some of them will be doing the research, and the universities are usually in the dental schools, but at the moment it's too early to say.